on AM 560, The Answer.
Now, from the Signature Bank Studios, this is Chicago's Morning Answer with Dan Proft and Amy Jacobson. If you're looking for the latest news, insight into what it means, and the sharpest opinion, there's only one station in Chicago where you can turn, and it's this one. We're AM 560, The Answer.
Top of the morning, Dan and Amy. Governor Jelly Belly issued a end-of-year message at the end of 2023, celebrating all of his accomplishments. Things are going great in the worst governed state in American history, he tells us. Take a listen.
Hello, Illinois. This is Governor
Hi.
J.B. Pritzker. Here we are at the end of another year. Despite all the challenges facing the nation and the world these days, thanks to your help, we've gotten big things done right here in the best state in America. We defeated the gun lobby and banned assault weapons and high-capacity magazines. While right-wingers in other states are banning books, we stopped them cold here in Illinois by banning book bans. Overcoming Republican opposition, we raised the minimum wage, expanded mental health care, made child care more affordable and available, and lowered the cost of getting a higher education degree. And while MAGA Republican extremists try to take away abortion rights, I founded Think Big America to fight back and make sure that they can't end a woman's right to make decisions about her own.
Exactly. Nothing is more pro-kid than killing him in the womb. That's what I always say. So that's a big accomplishments, particularly focus in on the health care, child health care, and so on and so forth. Okay. So now there's this report out, Race for Results, by the Annie Casey Foundation. By the way, this is another example of Robert Conquest's second law of politics. Something is not expressly conservative. Over time, it will become left. And the Annie Casey Foundation was started by James Casey, who was the founder of UPS, like in the late 40s. Okay. And now it's just another foundation that is essentially philanthropic washing for the left. Anyway, so Race for Results. And the top line is, Illinois is failing kids of color. So you heard Pritzker's message, and now from the left comes this report, Race for Results, Illinois failing kids of color. And so they brought on one of their flacks, Caitlin Jones, who's this mindless functionary for the YWCA of Chicago. YWCA of Chicago? Women's Christian Association, right? Young Women's Christian Association, YWCA. Their slogan, as you see on her backdrop when she does this interview with WGN, eliminating racism, empowering women. What?
Oh, my God.
So, right, it's all identitarian obsessed. So she's brought on to translate the results of the Annie Casey Foundation study. And it's just, again, the Rom-esque gobbledygook. It's just on child welfare and healthcare policy and the sort. Smart policies for all kids is great, but we need targeted policy.
Well, the reality is we need to focus on everything, because it's more than, just reading levels. It's more than poverty. It's also, how neighborhoods are doing, how they're faring, what kind of healthcare resources are available to parents, how their economic security is. I think the real thing this report underscores is the need to design and evaluate policies with special attention to the needs of these groups. Universal policies are great, but we actually need targeted policies to address the disparities that we're seeing across racial and ethnic groups in Illinois and the country more broadly.
Yeah, and she's focused on data points we talk about a lot, like the fact that, she says 1 in 3 kids of color in the state, only 1 in 3 read at grade level. It's lower than that. That's 1 in 3 all in. 1 in 3 of 1.85 million kids, matriculating through high school, but in 4th grade, read at grade level. 1 in 3, all in. 1 in 4 do math at grade level. And she continued, but, she's directionally correct. So that's not good. The impact of pandemic policy, That hasn't been good.
Yes, absolutely. A lot of these scores. So that's why I think, for example, like the reading indicator that I pointed to is so interesting to think about, because that is an indicator for how children are going to do as adults in terms of whether they'll graduate from high school, whether they'll enroll in college, what kind of financial security they'll have. And so we see these things from a very early age having a tremendous impact on people's lives and their economic security through adulthood, which is why it's really important that we start to and pay more attention to these kind of very early childhood issues that this report is highlighting.
Thank you so much. You know, it's great the Annie B. Casey Foundation did this report. So now that we know reading is important to kids, thank God. Now we know teaching kids to read is important. Thank you, Caitlin Jones. So we're not doing a good job. The pandemic didn't help any. In fact, obviously, it hurt significantly.
Yes.
But hey, don't forget, we live in Candide.
Yeah, so in looking at, Illinois has already done a pretty good job. We had an earned income tax credit, which is great, and we expanded it.
Everything's fine.
We've got hot tubs on the river. Come on, please.
Exactly. Yeah. Go take a ride on the Sea Dog. Go shop on the Mag Mile. Don't worry about it. Hey, what do you think the Bears should do for offensive coordinator? This is bad. It was made worse. Illinois is doing great. Okay, sure. Try and reconcile that. To help us follow that logic, if that is possible, we're pleased to be joined by Dr. Bill Hauter, who's a Republican member of the Illinois State House from 87th District. That's Central Illinois. Dr. Hauter, Representative Hauter, thanks for joining us. Appreciate it.
Good morning. Good morning, Dan and Amy.
Morning. You heard...
Sorry for the morning voice.
Oh, no, it's all right. We'll assess your bedside manner and let you know.
Yes. Well, I'm on my way to work this morning, so if you hear anything, that's
very, very good.
Going to work.
So you heard Pritzker's message, all the accomplishments. You heard the effort to provide a real assessment of what's happening at the developmental level for kids in this state, including with respect to health care. Before we get into specifically the migrant issue, and I know you haven't been in the General Assembly for a long time, which is why you probably still maintain some sanity. Just give us a Republican response, if you will, to what you heard.
Well, the crazy thing is, Dan, is that I feel like I come from a business of, medicine and being a physician. I'm an anesthesiologist in the Peoria area and also an emergency physician. So my whole life has been one of, outcomes, evidence, measurable variables. And I'm in this business now where it's like I'm in a fantasy world. And we actually sit on the floor of the House and listen to things like Illinois on top and going higher. And the other,
like brainwashing, huh?
Yeah. It's just like what world are we living in? This is a sentence I heard. Other states look to Illinois to see if they can replicate our success. And
you know what? Interesting. That's the same thing the Bears have on their bulletin board in the locker room.
Right. No, it's just like so. It's all based on feelings and narrative and power because we're so such a small super minority. We're irrelevant to them, and with that irrelevancy, they don't feel accountable to anything. They're not accountable to the media. They're not accountable to the voters. So I can just go on and on about how it's hard to battle when you're battling not reality, and when you're battling false narratives and untruth without evidence. So when you bring up evidence, that's just dismissed. And so, we can talk about, the evidence and the reality of what's happening with this migrant situation, especially in regard to healthcare.
Well,
And
let's do that, because I mean, again, I think people don't appreciate the largest budget item in the state budget is not K through 12 education, it's Medicaid, and that's only expanded over the last several governors, where now we're running at about 1 in 3 Illinois residents, like legal residents, are Medicaid eligible, and now you've got the influx of people from other countries that are being covered. Their health care is being covered by Medicaid as well, meaning taxpayers. And this is a huge number, and it's going to start growing perhaps exponentially based on the influx that is occurring.
Exactly. So, when you look at this, it's a real abdication of our fiduciary responsibility to the taxpayers of Illinois. When we say Illinoisans are not only first, but they're last, and they're behind non-citizens in the Medicaid system. So when we have the Medicaid system for working poor adults in Illinois, and that system is in a managed care organization, an MCO, and with that comes denials of care, pre-authorizations, co-pays. Then we set up from age 42 to seniors a system that's Medicaid-like for immigrants. That is a fee-for-service, no managed care. It's absolutely golden Cadillac insurance, and it's taking away over $1 billion from the Illinoisans that are vulnerable and need the health insurance. It's just, to me, it's almost evil.
Well, then what should we be doing? What do you suggest?
I think we just continue. We have to persevere, and that's been a big thing with me in my first year is saying, when you see how far down we are and how what a deep minority we are and how irrelevant we are, what do we do? Well, they want us to give up, right, Amy? They want us to give up and to say, Illinois, it's not worth fighting for. I know I've thought about leaving, but in the end, I think our job is to continue to fight and to continue to bring the reality of the situation. And, I think the only thing we can do is I take from the Bible, I take, 2 Corinthians 4, there's verses in there that we're crushed. I mean, we are hard pressed on all sides, but we are not crushed. We have to stay in Illinois. We have to stay and fight because this is our home. And when we lose our people that become so frustrated by the situation, they don't care, because who's leaving Illinois? It's the businesses, it's the makers, it's the people that are productive. And who are they bringing in is a huge, a population of illegal immigrants, and also whatever you want to call them. If you say illegal immigrants on the House floor, you may be strung up from the rafters.
Yeah, I wouldn't encourage you to make I wouldn't encourage you to make a biblical reference either, because I believe Pritzker has banned that book in Illinois. I'm not sure.
No, we don't have any book banning. No.
Yeah, right. So here's, but I mean, here's one thing, and we talked about this a bit yesterday. Modeling after the daily COVID briefings. Now, of course, Pritzker is not going to do these briefings with respect to migrants and the cost being imposed and exactly what you're describing. That hasn't gotten enough coverage. The idea that migrants are getting Cadillac healthcare coverage as compared to Illinois residents who are getting that managed care regime. That's a really important point. But what about Freedom Caucus in the House has suggested this too, Brad Halbrook and Chris Miller and company, that you would do daily migrant briefings, that just the number of people you can track these bus reports and train reports of migrants being dropped off and where they're being dropped off by these regional emergency response agencies. We certainly have them in Cook County. Sure. And here's who's being dropped off, or how many being dropped off, where they're going. Here's what the state costs are in terms of what you were describing with respect to the fee-for-service Medicaid coverage and associated costs that are being borne by taxpayers, and just put out daily briefings. I mean, you would build a community around that information. What about that?
I mean, I think that's a great idea. That kind of transparency is definitely needed. And you mentioned another thing is that the continued rule by executive order, and we're under this is
emergency declarations. Yeah.
Yes, emergency declarations. And one of the reasons why I ran for office, Dan, was because of COVID. And as a physician, I saw, the lockdowns, the mandates, and the coerced consent for vaccinations. And as a physician, I saw that there was not one medical person in the House or the Senate. There's not one medical doctor. I'm the only medical doctor in the legislature of Illinois for over 30 years. So to me, we had a huge public health emergency, and no one was speaking for the people. It was ruled by one man, and he continued that for way too long. We saw that when every other state had dropped their emergency declarations. He kept it on until the very last day of the last month that it could be kept on, and then he switched to emergency declarations for a migrant crisis, so that he can move money around at will. And there's very little transparency, and we struggle to find out where billions of dollars are being spent of Illinoisans' money. This healthcare crisis, or this healthcare program, HBIA, healthcare benefits for immigrant seniors and adults, is the A. That program last fiscal year cost over $1 billion.
Mm-hmm.
You know how much they thought it was going to cost?
How much?
$200 million.
Only off by a factor of 5. That's pretty good for them.
Yeah, pretty good. And so, so what would you say when you have expanded this? It would be in your budget. What would you say it would be? Well, would probably, unless we do something drastic, it's going to be about that same amount. No, they said it's going to be $550 million. This is, again, an example of the unreality of the situation.
Right.
So
it'll be
budget.
So it'll be $2.5 billion. It'll be $3 billion. It'll be $5 billion this time. But what's the difference to them, right?
Yep. But they said in the budget it's only going to be $500 because we're going to institute cost savings. What are those cost savings? Well, we're going to stop new enrollees, which they have done that. But they're going to institute managed care for these people. It hasn't happened. So they continue to get fee-for-service. They can go to any doctor's office, don't have to get pre-authorizations for any kind of treatment, don't have denial of care like other Illinoisans do. And then they said, we're going to institute co-pays, just like everybody else. But did that happen? No. That was immediately protested, and the political fallout from that, from the Hispanic caucus and others, was how dare you make these poor people have a copay for any kind of treatment. So that's not been instituted. So right now, that $550 million that they budgeted, we're only at over $800 million that we can see. But again, they're not transparent with us or to the Illinoisans about what this is costing. But we think right now it's over $800 million, and it'll probably be just as close as it was last year. But to balance the budget, they just say whatever they want to say.
Dr. Bill Hauter, Republican member of the Illinois State House, 87th District, that's Central Illinois, the Peoria area, as he was saying. Dr. Hauter, thanks so much for joining us and explaining what's going on down there. Please keep us informed and distribute whatever information you are able to glean from how money is being spent down there, particularly on the healthcare issue with people who are in this country illegally, largely. Dr. Hauter, thanks so much for joining us. Appreciate it.
Well, thanks for having me, and have a good day. Stay safe.
Yeah, thank you. And he joined us on our turnkey.pro answer line.
It's what Chicago is talking about. It's Chicago's Morning Answer with Dan and Amy on AM 560. The Answer.
It's a new year, and that means New Year's resolutions. Hi, Amy Jacobson here. And if one of your New Year's resolutions was to do more to help others, then we want to let you know that you still have the opportunity to make a difference in the lives of children in Latin America and the Caribbean through Food for the Poor. Your donation of just $80 provides food for an entire year for 2 children. That's life-changing. Just because the Christmas season is over, that doesn't mean that the need has gone away. Food for the Poor is a faith-based organization that works with partners on the ground to make